today we will give some impression about the dissection room, okay, and also we will start with the bones, that means about the general aspects of the bone. Now, what is bone? Bone, we know it forms a structural framework of our body. If we don't have any bone, what will happen? Everything will crumble. No support, nothing. Like invertebrates, we have to crawl throughout the floor. তোমাদের কি don't have here? Now, this is a modified connective tissue. We know there are some connective tissue, like we get just below the skin, we get some connective tissue which is called which connects the superficial skin and the muscles. Here we get the connective tissue, and deep to the muscle we get also the bone, that is also a connective tissue, that is a modified connective tissue in our body. The modified connective tissue in our body is bones, blood. They are a connective tissue because it connects the different parts of the body. There is a circulatory system through which we can, blood vascular system that also connects the each and every part of our body. Now, this bone is also a connective tissue, and there is another substance which is called cartilage, which is also a bit firmer, but bone is definitely harder than the cartilage. So, cartilage is necessary where the hardness as well as resilience or elasticity is also needed. We can get the thyroid cartilage. It should be, and also we get the trachea, thyroid cartilage, trachea. They are definitely firm. At the same time, they are elastic. So, but the bones are definitely firmer. And in the bones, what we get, there are several varieties of bones. This is a bone. This is a bone. We can also find this is a bone. Okay. So there, but definitely there is some difference. So this type of bone is called the long bone. Long bone. Why? The length is more than the breadth. Similarly, in upper extremity, we get the humerus, that is also a long bone, and in the lower extremity, we get this bone, this is the femur. So, these are the long bones. Okay. Again, if I look here, we can get these are the metacarpal bones. This is a hand. This is the articulated skeleton of the hand. Okay. So we get the metacarpals. These metacarpal bones are also long bones, but there is a difference between, definitely there is a difference between this long bone and this long bone. So it is called long bone, and this is called short long bone. In this long bone, we get some peculiarity. That means here we get some ends we can get. That means this is the upper end and this is the lower end. Tomorrow there is a class, I think, what is ventral, dorsal, lateral, you will know. In anatomy, what is anatomy? Anatomy, I am not going into it because this up cutting. That means it was in history, we used to dissect the body, we used to see the structure of the body, that is the up cutting of the or dissection of the body. That is, and study of the structure of the body, that is the anatomy. But there are some things like, if I keep our position like this becomes the anatomical position. So this is the upper limb, it may be held away, it may be held towards the midline of the body, it may be kept away from the body. So towards the midline it is called medial, this is called lateral. You will know everything. Some is proximal, that is distal, this is proximal and this is distal. Similarly in the femur, the upper end is proximal, this is the distal. So with that we will know tomorrow, okay. Now this is the end. So there are, in long bone, there are two ends. One is upper end and one is, because it is hanging like this, so this is the lower end. And intervening body or the shaft, body or the shaft. So upper end and lower end. In typical long bone, this is the most important feature, that is upper end. Whenever we will describe a bone, first we have to put in anatomical position, then we have to say this is a humerus, this has got upper end, this has got lower end, and intervening shaft of the body. Student, but in short long bone, it has got upper end or lower end, whichever you can describe, and only the shaft. It has only, that means if we see there are two ends, here we are getting upper end, lower end and intervening shaft, and these ends in a long bone, in a young long bone, the ends of the young long bone, they remain separated from the body or the shaft, and that part is called, those parts which remain separate in a young long bone, they are called the epiphysis. Epiphysis. So there are two epiphyses in a long bone. One is in the upper part and one in the lower part. And intervening shaft, that is called diaphysis. Epiphysis and diaphysis. After attainment of some age or maturity, these two ends gets fused with the shaft or the diaphysis. Okay. So, I am repeating, in a young long bone, it is fused, but in young long bone, this upper end and lower end will remain separate. They are called epiphysis, and the intervening shaft or the body is called the diaphysis. Now, suppose this is the junction between epiphysis and diaphysis. Now, the whole part is called the diaphysis. Again, this part of the diaphysis, which is quite near to the epiphysis, is called metaphysis, or epiphyseal end of the diaphysis is called the metaphysis. Metaphysis is very important part of the bone because we get prominent blood supply in the metaphyseal end, and there are some hairpin bend of the artery. Actually, one artery goes inside, which is called the nutrient artery, and we can find the opening of the nutrient artery. If we look here, we can find the opening of the nutrient artery. If we see it very closely, we can find one opening, that is called opening for the nutrient artery. Actually, the artery enters through this opening, and it gets divided into two parts, one for above and one for below. They are called the nutriti. Nutriti. One artery divides into two, and one is giving supply to the upper part, one is giving its nutrition to the lower part. So, they are called nutriti. And ultimately, this artery, nutriti, actually forms a hairpin bends near the metaphysis. Okay. So, metaphysis area which is near to the epiphyseal end. Okay, and that area is highly vascular. That means it's supplied by blood vessels, and the part which is definitely vascular, what will happen? There is chance of infection if there is a very vascular part, and there is a hairpin bend, and there is slowing of the artery, slowing of the circulation. So, there is metaphysis is very vulnerable site for development of any infection of the bone, which is called osteomyelitis, that we will learn in pathology. So, epiphysis and diaphysis. Epiphysis and diaphysis. And in long bone, this is the long bone. So, in long bone, we are getting two epiphysis and one diaphysis. Whereas, in short long bone, we get epiphysis, only one epiphysis here, and only diaphysis. So, in short long bone, there is only one epiphysis, and rest is called the diaphysis. This is very important. Okay. Now, if there is a long bone, there should be a short bones. Like these carpal bones, okay, which actually overrides one another, okay. These bones actually overrides over one another, so that we can negotiate the bangles. So these are the short bones, okay, and these short bones are brick-like. They have, in a brick we can find there are 6 surfaces. Here we also get some surfaces. One is anterior surface, one is posterior surface, one is superior surface, one is inferior surface, okay, and there are 2 lateral surfaces, okay. So they are small brick-like bones. So these are the short bones. Now what is the difference between the long bone and the short bone? Appearance first. Then another important part of the bone, that is, I have already said there is the epiphysis. There are 2 epiphyses and 1 diaphysis. Again, try to remember one thing. This diaphysis is the part of the bone which ossifies from primary center of ossification. Babare, eta abar ki kotha bolchen? What is primary center of ossification, sir? What is ossification? এগুলো আবার কি বলছেন, কেন বলছেন? Ossification is the process of bone formation. সহজ হলো? So in intrauterine life there was no ossification. Absolutely, this was a mesodermal tissue, okay. We know ectoderm, mesoderm and endoderm. So it is developing from the mesoderm. There is no bone formation. So at one moment of time there is appearance of small dot. In USG we can find in a fetus, a small dot is there. There is a primary center of ossification. What is primary center of ossification? The centers of ossification which appears before birth, generally before birth. And what are the secondary centers? They generally appears after birth. So this is the shaft or the diaphysis which ossifies from the primary center, and these are the epiphysis which ossifies from the secondary center. That means here the ossification centers appears generally after birth, but there is an exception. Of the femur, there is an exception. So this is the epiphysis, that means it ossifies from the secondary center, but the secondary center here appears just before birth. Just before birth. Again I am repeating, what is primary center of ossification? From where the major part of the bone ossifies and which appears before birth. Secondary center of ossification, from where the accessory parts of the bone, that means the ends, ossifies. And there is center of ossification or the secondary center of ossification which appears generally after birth. So, though this is the epiphysis, this is the secondary, here we can expect the secondary center. This is the epiphysis where here we can expect the secondary center. But in the lower end of the body, lower end of the femur and or in the upper end of the tibia, the secondary center appears. But definitely in femur and sometimes in tibia, the secondary centers, those actually secondary centers generally appears after birth, like 1 year, 2 year, 3 year, like that. But they appear just before birth, and that is very important. That is the medico-legal importance. So, if a baby is born, whether that is live born or dead born, okay, whatever might be, okay, whether it was there is any scope of there is any suspicion of infanticide, okay, we can check, this lower end, if there is appearance of the center, then we can say that okay, that the baby was matured because it appears just before birth. So, long bone, okay, and this is the short bone, and in short bone there is no primary, there is no secondary centers, okay, and these centers of ossification actually appears generally after birth. Okay. Now, this is another bone which is called sternum. These are called ribs. So, these bones are called the flat bones. Flat bones. Okay. And also, this is the skull. This is the upper part of the skull, and which actually we can remove it, okay, like a cap, which is called the skull cap or calvaria, and that part is also flat. So those are called the flat bones. Similarly, we can also find it is a scapula. So this is also, it has got flat body. So long bone, short bone, flat bone. Then another bone we can find, this is called maxilla, and within the maxilla, and there is another deep-seated bone that is called sphenoid, ethmoid. There are some bones which are oriented around the nasal cavity. That means maxilla, most inside there is a sphenoid, and in between the frontal bone there is called ethmoid bone, and these bones have actually, the bones can accommodate air. That's why the bones are lighter. This bone, that means the maxilla, sphenoid, ethmoid, they contains air. Air is also called pneuma. Pneuma. Air is also another name of air is pneuma. So those bones are called pneumatic bones. রসগোল্লা দেখেছো? রসগোল্লার একদম ভেতরে একটা কি থাকে? ভেতরটা যদি কাটো, ভেতরে একটা কি থাকে? একটা পুর থাকে ভেতরে। পুরটাকে যদি বার করে দাও, ফাঁপা, তাই তো? So that is the structure of those bones, because inside is inside of the bone we will get the air, nothing else. But if there is accumulation of some secretion inside the, and those area where we get the air, they are called sinus. So there are some sinus within the maxillary bone. There the sinuses are present within the sphenoid and ethmoid bone, and so that sinus or air cavity, actually it has got several purpose. First, it actually it lightens the bone. It becomes lighter. Second, they are the air conditioning chambers. When we are inspiring, air enters into these sinuses. Okay, and that air, there are lining epithelium, and the lining epithelium, actually there we will get the blood vessels. So that air is coming in contact with the blood vessels, and it becomes warmer during our winter period. And that after that, that air is goes inside, and it passes through the respiratory tract. So it forms the air conditioning chamber. So those bones are called pneumatic bones. And there are some bones like the vertebra. This is called the hip bone. They are irregular. Even this one is also irregular in shape. Irregular shape. They are called irregular bones. Whatever might be the type of the bone, suppose this is a flat bone, rib, sternum, flat bone. What we get? There are two tables. One table is outside, one table is inside. And this outer and inner table are composed of compact bone. Compact bone. That means the osteocytes are in close proximity. And in between, we get a thin layer of spongy bone. Okay. So this flat bone has got outer table and intertable of compact bone, and in between we will get spongy bone. It is also present in this calvary on the skull cap. Okay. Here outer table and inner table we will get outer table, inner table, and in between there is spongy bone. Okay. This is the anatomy of the flat bones. Similarly, here we will get the outer and inner compact bone, and in between spongy bones. But in long bone, what we will get? In long bone, we will get definitely outer compact bone, inner spongy bone is there, and most inside we will get the medullary cavity. Suppose this is the bone, the compact bone, and inside we will get the medullary cavity where we will get the hemophysis. Okay, we can see the hemopoietic tissue, okay, especially at the ends, the red bone marrows. Okay, after birth and before birth, this whole bone marrow is red in color. That means it's a red bone marrow. And as age advances, we can find the red bone marrow more on the ends. Okay. So, in long bone also we will get outer compact bone, inner spongy bone, and most inside we will get the medullary cavity. And most outside there is one very shiny layer which is called the periosteum. Periosteum. And more inside, and most inside we will get another shiny layer that is called endosteum. So, this is periosteum, this is endosteum. So, from outside inside, this is the periosteum, then the compact bone, then the spongy bone, then the endosteum, then is the medullary cavity. But in these long bones, as age advances, the spongy bones actually gets dispersed over the ends. Okay. So, long bone, short bone, pneumatic bone, irregular bone, and another bone is left that is very important. বলতে পারবে একটা বোন আমি বাদ দিয়ে গেছি? Yes, খুব ভালো বলেছে। Sesamoid bone, this is the seed like bone. Sesam, that is seed, Arabic word. That is the sesamoid bone. This is the largest sesamoid bone of the body, that is called the patella. What is called the sesamoid bones? Actually, they remain under the coverage of a muscle tendon. Here the quadriceps muscle is there, the four muscle in the lower limb, that is in the thigh, front of the thigh, that is the quadriceps femoris, and which ends in a tendon, and it is under the coverage of this muscle. So, or the tendon, muscle tendon. So, sesamoid bone is a bone which remains under the coverage of a muscle. In case of patella, this is the ligamentum patelli, and that is formed by the quadriceps muscles. Okay, muscle tendons. The quadriceps means four muscle. See, those four muscle actually unites, that the tendons gets unite. What is tendon? You will know. Actually, the fleshy part is called feel that muscle is a flesh. No, at the same time there is a collagen tissue, very firm collagen tissue at its ends, which are called the tendons. Okay. So, that tendon passes over this bone. So, sesamoid bone is also present in our hand. Okay, in our hand, These are the carpal bones, and this bone is called the pisiform bone. Pisiform, and we can feel this bone here. Okay, we can feel this bone, that pisiform bone, and this is that pisiform bone, and this pisiform bone is also a sesamoid bone because it remains under the coverage of one muscle tendon. One muscle is called flexor carpi ulnaris, and it is under the coverage of that muscle. Okay, so we can find sesamoid bone. There is a gastrocnemius muscle. You will know there is a gastrocnemius muscle in the in the leg. On a posterior aspect, one muscle is there, that is the gastrocnemius muscle, and within the gastrocnemius muscle, on the lateral head of the gastrocnemius, there is another sesamoid bone which is called fibula. Another sesamoid bone, you will learn gradually. There is a muscle tendon, okay, that is adductor longus. You will know in the lower limb, that is that. And within the adductor longus muscle, there is another sesamoid bone which is called a rider's bone. So there are so many bones, so many seed-like bones. And what is the most important characteristic of this sesamoid bone? Within the bone, we get an Haversian system. Gradually, you will learn in histology class. Within the bone, there is an Haversian system. Haversian canal, Bachmann's canal. These are outer layer, outer lamella, inner lamella. That is called Haversian system. In all bones, we will in compact bone, we will see the Haversian system. That Haversian system is absent. In the long bones or any short bones, we will get the blood supply. There is no separate blood supply for this sesamoid bone. So, no Haversian system, no blood supply. We are seeing there is outer layer which is called the periosteum, periosteal layer of the bone. Periosteal layer means outer layer from where, actually it's a shiny layer from where then actually the nutrition and also the bone formation which helps in formation of bones after any fracture. If there is any fracture, okay, fracture will heal up, and this outer periosteal layer actually helps in healing of the fracture. So that is the outer periosteal layer. It has got no periosteum. So it has got no Haversian system. It has got no blood supply. Okay. Then you may ask me, from where it will get the nutrition? If there is no blood supply, actually it remains under the coverage of a muscle or muscle tendon. That muscle will give nutrition to this bone. So this is called sesamoid bone, and this sesamoid bone often comes in your examination. Short note, sesamoid bone, এই প্রথম শুরু হলো, তাই তো? পরীক্ষাও শুরু হলো, sesamoid bone. What is this? Vertebra. That is the irregular bone. Total how many vertebrae are there? In the cervical region, 7. In thoracic region, 12. In, this is called lumbar region. In the lumbar region, 5. And also the 5 sacral vertebra gets fused to form single piece of bone, and one coccyx, actually it is coccyx is actually, this is ossified with the sacrum. So coccyx actually also it has 4 pieces of bones. So ultimately we get 33 number of vertebrae. But fortunately they are ossified, and we will get only 2 pieces. One is sacrum, one is coccyx, and along with we will get 24 plus 2, that is 26 vertebrae are there. And this vertebra, we has got several parts. One is body. This is the body of the vertebra. This is the spinous process, and these are the transverse process. And here we are getting a neural canal for passage of the spinal cord, and that spinal cord ends at the level of L1 vertebra, from where only the tufts of nerve fibers actually comes out, which looks like the tail of a horse, which is called the cauda equina. So this vertebra is called an irregular bone. Okay. Superimpose. I like to superimpose this bone with this one. So this is the maxilla, and left-sided maxilla, and within the maxilla you can find one opening, and this opening is for the maxillary air sinus. Here we will get the air. Okay. This is the anatomical position. So this is the nasal cavity, and from the nasal cavity air will enter inside the sinus or the maxillary air sinus. Similarly, we can get it's a bat-like bone. Bat-like. You can Bangla ki bole badu. Okay. Outstretched wings. Okay. 2 wings. And these are the legs. This is the sphenoid bone. Okay. And this is the body of the sphenoid, and inside the sphenoid body we can get the air. Okay, that is the sphenoidal air sinuses. This is the maxillary air sinus. Okay, and this is the sphenoidal air sinus. Where is it? This is the sphenoid. Okay, this is the sphenoid, part of the sphenoid. There is another bone. Long bone, short bone, flat bone, irregular bone. Which type of bone? Definitely long bone, because length is more than the breadth. But you can find this is a long bone. These bones are oriented vertically. All the long bones are oriented vertically. This is the only long bone which is dispersed horizontally. So this bone is called modified long bone. There are other points why we call it as a modified long bone. The first is the orientation. All the long bones are vertically oriented. Actually, what are the characteristics of long bone? They are, the length is more than the breadth, vertically they are oriented, and they bears the weight of the body. So, also this this bone, this clavicle, also bears the weight of the body. Okay, there is coracoclavicular ligament. If we give a pull, there is normal reaction. If we give a pull here, there we will get a similar normal reaction above, and it will pass through these bones, and ultimately it will reach this clavicle, and from here it will reach to the vertebra. So it bears the body of the weight. Bears the body of bears the weight of the upper limb. So this is the long bone. So it has got length is more than the breadth. It also bears the weight of the body, so it is long bone. But as because of the fact it is dispersed horizontally, so this is called modified long bone. And also all the long bones remains, they are deep seated, but this long bone is subcutaneous. We can find this long bone subcutaneous in position, and one subcutaneous nerve which is called supraclavicular nerve, which is coming from above. Okay, there are three branches of supraclavicular nerve. One of the branches will pierce this bone. Subcutaneous nerve pierce this bone. In long bone you cannot find any subcutaneous nerve will pierce it. But here we will get a subcutaneous nerve which is called supraclavicular nerve. Above the clavicle, so it is called supraclavicular. That nerve will pierce this bone. So it is also called dermal bone. Dermal bone. Dermal because the cutaneous, just below the cutaneous skin, and also it is pierced by the subcutaneous nerve. Long bone has got medullary cavity. We cannot hardly find any medullary cavity here. So it is called the modified long bone. Long bone, long bone, short bones, modified long bone, flat bone, ribs, sternum, okay, hip bones, skull caps, all the flat bones, pneumatic bones. Okay. Now what is the function of the bone? First, it forms a structural framework. Second, if we punch, anything will happen. Inside there is lung, there is heart. So it protects the different viscera. The vital viscera it can protect, except the abdominal viscera. But there is a protection that is being protected by this anterior abdominal wall. It gets taut and it can protect. So, structural framework. Second, it protects the underlying vital viscera. Third, it is the storehouse of the calcium. It acts as a lever for muscle attachment. Muscles are attached with it and it acts as a lever. Okay. And in intrauterine life, it also helps in hemophysis. That means formation of different blood cells, red, white, platelet, everything. Okay. And in case of adult, the ends of the long bone, medullary cavity, they are the sites for the, and the red bone marrow, they are the sites for the hemophysis. Okay. So this becomes an introduction. এবার তোমাদের একটু এটা একটু বুঝিয়ে দিই কি কি আছে, ওদের একটু ডাকি তোমাদের। তোমাকে দেখতে চিনতে হবে, এটা হচ্ছে কি এন্ড, কালকে পড়াবো আমি। এটা হচ্ছে স্টার্নাল এন্ড, এটা হচ্ছে অ্যাক্রোমিয়াল এন্ড, তলায় একটা গ্রুপ, মানে চিনতে হয় এইভাবে, মানে এন্ডস। দিস ইজ quadrangular, this is flat, the flat end is laterally placed and that is called acromial ends, and this is the quadrangular shape. So quadrangular end is towards the sternum, this is sternal end, আমি তো এভাবেও রাখতে পারি। And above and below is identified by this groove. সব শিখবে, subclavian groove। নার্ভের তিনটে ব্রাঞ্চ আছে, একটা হচ্ছে ল্যাটারাল, একটা মিডিয়াল এন্ড ইন্টারমিডিয়েট। অনলি দ্য ইন্টারমিডিয়েট ব্রাঞ্চ উইল পিয়ার্স। তিনটে ব্রাঞ্চ দেখালাম ত্রিশূলের মতো, রিমেন্স সাবকিউটেনিয়াস। Intermediate branch actually pierces this bone. So cadaver, the first point is, who will teach you the anatomy? Who will teach you? Only and only the cadaver will teach you the anatomy. We will not. Okay. So we will place the cadaver, and there are some decorums we have to maintain. Okay. The cadaveric oath will, during cadaveric oath taking ceremony, you will learn that one. Okay. Because we cannot click any photograph with the cadaver. We cannot joke with these cadavers because they have given us the opportunity to dissect and to learn anatomy. Okay. So here we place the cadavers. Now we will see. একেবারে হয়ে যাবে, মানে ওই ফরমালিনে এখন সহ্য করতে পারছে না। The chamber where we keep our cadavers. Okay. এটাতে লাগবে না শুরু করতে। You can see these are chambers. We keep, this is the embalming fluid. Okay. And generally it contains high amount of the formalin. There are several actually chemicals are there, formalin, glycerol, okay, and other preservatives are also. So first of all, you will feel something, it is a pungent smell, you have to actually gradually you will get accustomed with it. Okay. So this is the chamber. The process of sterilization and preservation, that is called embalming. That is a process. Actually the embalming fluid is prepared, around 10 liter of embalming fluid is prepared, and it is injected through a injector machine, and through which route? Through the femoral route. the femoral artery is dissected out, and through that we actually inject that embalming fluid, and it spreads over the body, okay, throughout the body. And there are, we can choose the carotid artery and others, okay. So ultimately that fluid actually through the injector machine, actually we actually inject that the whole 10 liter of fluid in the body, and at one point of time there will be swelling of the lips, okay, swelling of the eyes. Then we can at that moment of time we become sure that the embalming process is complete. So that room is called embalming room. You can see on that side where I went there, okay. That is the embalming process of embalming, okay. But generally till now we are getting the donated already embalmed body from other colleges, okay. So we will start embalming also, because in our government colleges it's a regular procedure, absolutely regular procedure by which a fresh body is preserved. Actually, when we accept the body, first we put it in a mortuary. There is also mortuary, and mortuary means freezer, okay, freezing chamber, okay. Suppose we have accepted that body at late night, where we will keep it? We will keep it in the mortuary or the freezer, okay. From cold chamber, in the next morning we will take out and we will put it in the embalming room, and the process of the embalming is done, okay.